We begin this morning, though, with a renewed push for action on voting rights as President Biden calls for a major change to Senate rules.
Democrats want to move quickly. The Senate could vote on 2 federal voting rights bills as early as today. In a speech in Atlanta yesterday, President Biden lambasted the Senate for not taking action and framed this issue as one for the history books.
I ask every elected official in America, how do you want to be remembered? Do you want to be on the side of Dr. King or George Wallace? Do you want to be on the side of John Lewis or Bull Connor? Do you want to be on the side of Abraham Lincoln or Jefferson Davis? This is the moment to decide.
NBC News White House correspondent Carol Lee joins us now from Washington. Carol, good morning to you. So the president's speech marked really a big reversal for President Biden, an institutionalist who spent years defending the filibuster while serving in the Senate. So how exactly is the White House planning on getting this done? Can they realistically do it?
Yeah, Joe, look, they're going to try, but the votes just aren't there right now. And you're right, this is a really significant reversal for President Biden, who spent decades in the Senate and for years now has said he opposes changes to the filibuster. But yesterday in his speech in Atlanta, he said things are different now. Take a listen.
Sadly, the United States Senate, designed to be the world's greatest deliberative body, has been rendered a shell of its former self. Gives me no satisfaction in saying that as an institutionalist, as a man who was honored to serve in the Senate. But as an institutionalist, I believe that the threat to our democracy is so grave that we must find a way to pass these voting rights bills.
So how's the White House going to get this done? Look, unless they can get all 50 Democrats to support getting rid of the filibuster altogether, this is impossible because they need 67 votes in the Senate to do anything short of what's called the nuclear option. So anything, something like a carve out for voting rights or the talking filibuster, as it's known, forcing senators to stand on the Senate floor and talk through a filibuster. So it's just looking increasingly like this is a non-starter, Joe.
I mean, Carol, it's worth noting so far no Republicans in the Senate have come out in support of these bills. Obviously, they're not needed if the filibuster rules change. But how are Republicans reacting to the president's call for change yesterday?
Right. Republicans have been blocking this voting rights legislation, which is why Democrats are talking about changing the filibuster. And no surprise, they were sharply critical of the president's speech. And Senate Minority Leader Mitch McConnell even said if Democrats were to go down this path and try to get rid of the filibuster, that he would really make it harder for them to get anything done in the Senate. Take a listen.
If my colleague tries to break the Senate to silence those millions of Americans, we will make their voices heard in this chamber in ways that are more inconvenient for the majority and this White House than what anybody has seen in living memory.
So other Republican senators came out and were criticizing the president, saying that his speech was overly political. But look, Joe, that wasn't the president's audience. The president's audience were Democrats in the Senate and the Democratic base, who's been really putting a lot of pressure on him to make a speech like this and lean into a push for voting rights legislation.
Of course, ultimately what matters here are the moderate Democrats, Joe Manchin and Kyrsten Sinema. They've said they oppose changing Senate rules. That, of course, sinks the Democrats' efforts, as you pointed out. How does the White House plan to get them on board? Because that's everything for them right now.
It is. You're absolutely right. And look, they're saying, hey, we're going to have all these conversations with senators. We're going to use the bully pulpit. The president will continue to hit on this issue publicly. And the president said yesterday that he's had conversations with Democratic senators in recent weeks about this. But all of that talking is not going to change the fact that even Senator Manchin, for instance, has really dug in on his opposition to getting rid of the filibuster. And absent that, it's just hard to see where this goes.
Carol Lee reporting from the White House. Carol, thanks so much.
Now, notably absent from President Biden's speech in Georgia yesterday were some key voting rights activists. Some of them have slammed the White House, saying anything short of a concrete plan to pass voting rights legislation is unacceptable. Meanwhile, Republicans say they're not trying to restrict voters. NBC News correspondent Blaine Alexander is in Atlanta with the latest.
I'm Blaine Alexander in Georgia, where organizers tell us it's a race against the clock to pass Democrats' new voting legislation.
Democracy hangs in the balance.
But they're worried President Biden is speaking up too little, too late. His Georgia trip marks a return to the state that gave Democrats the Senate majority. But he's being met with an icy reception from some of the very organizers behind those victories. While some voting rights activists are in attendance, others choosing to skip the speech, calling anything short of a concrete plan to pass Democrats' legislation unacceptable, an empty gesture. Georgia has progressively become more progressive, narrowly flipping for Biden in 2020 by less than 12,000 votes. Now, the groups that helped drive record Democratic turnout say to bring voters out again, it's time for a return on their investment.
What is your biggest fear if this legislation does not pass?
Our biggest fear is we have nothing to say to these voters as to why they should come out again in the midterms and make their voices heard, because this administration has given us there's no meat on the bone.
Republicans are defending Georgia's controversial new voting law, slammed by critics as voter suppression. Governor Brian Kemp says it's the opposite.
Georgia's Elections Integrity Act makes it easy to vote and hard to cheat.
Last year, President Biden told Georgia Democrats electing 2 Democratic senators would mean a green light for his agenda.
The power is literally in your hands.
Now the pressure is on from Democrats for him to deliver. And some of those activists told me that they liked what they heard in the speech, but they wanted to hear the president call out some of the holdouts in his own party. In Atlanta, I'm Blaine Alexander, NBC News.
This morning, the out-of-control Omicron variant is putting a bigger strain on the nation's hospitals.
Yeah, COVID hospitalizations have now reached a record high, with more than 145,000 people currently admitted with the virus. That means about 1 in 2,300 Americans are hospitalized with COVID right now. As nurses and doctors try to treat thousands of new patients, the nation's top health experts were on Capitol Hill yesterday trying to defend the CDC's mixed messaging on Omicron and quarantine guidelines.
A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. As we will learn more, we will continue to update accordingly. Omicron is likely not to be the last curveball this virus throws at us, but we have the tools to prevent further spread of this virus.
Hospitals right now, they are trying to fight the curveball Omicron has thrown at them. They're running out of hospital beds and workers as some staff come down with the virus themselves. That includes doctors in North Carolina, where we find NBC News medical reporter Erica Edwards. She joins us now from a testing site in Charlotte. Erica, good morning. So let's talk about the hospitalizations first, just there where you are. How is it in the Carolinas? Are the hospital systems holding up with this Omicron surge?
Yeah, hey, Savannah, good morning. I'll tell you what, cases here in the Carolinas have absolutely exploded in the past few weeks. What's more, that means people who are getting COVID-19 are sick enough to be hospitalized. Check out some of these numbers. In South Carolina, the number of COVID-related hospitalizations has risen more than 1,100% in the past 2 weeks. Unbelievably, that is not a typo. In North Carolina, hospitalizations are up 768% in the past 2 weeks. Compare that to the national numbers, not doing much better. Hospitalizations have quadrupled in the past 2 weeks. Now, despite this, we talked with an infectious diseases expert at Wake Forest who said that there's a bit of good news here. People who are hospitalized aren't necessarily as sick as they were earlier in the pandemic. Take a listen.
We're about 25% higher than we were at this time last year. And last year was obviously the previous big peak for hospitalizations. But we are seeing fewer people in the ICUs compared to last year, and also even compared to Delta in August and September. So there's a little bit of a silver lining there.
Still, Dr. Ohl said the sheer rise in cases is absolutely crippling the healthcare system. Savannah, Joe?
Erica, we just heard CDC Director Walensky defend her agency's messaging. That includes the guidance on quarantines. Even with the shorter 5-day isolation period now, a lot of hospital workers still can't get back to work right away. What is the impact on those who are going to the hospital for things other than COVID?
Put simply, they cannot get the care that they need. Let me give you an example. At Duke University Hospital in the Raleigh-Durham area, there were more than 1,000 healthcare workers out sick in isolation because of COVID-19 within the past week. And that means that there are fewer doctors, fewer nurses to take care of those routine, everyday illnesses. We talked with Dr. Cameron Wolf of Duke University Hospital. Here's how he explained the problem.
Someone who was due to get an elective surgery can't, it gets cancelled. It means someone who sits in the ED for their broken leg likely sits there for many more hours. It means someone who needed a clinic visit may have that clinic visit cancelled at the last minute because we can't get staffing for that visit. It bleeds into other areas of healthcare, not just COVID.
Dr. Wolf said that in a matter of about 3 weeks, they went from having 60 hospitalized patients with COVID-19 to 260. That's a faster rise than they'd seen before in the pandemic.
Wow, yeah. Now, Erica, also the testing site you're at, as many across the country have seen, are seeing this major rise in positive test results. One of the issues, though, that we're hearing about is access to testing. If you're not at one of these sites like you're at, you can't get your hands on an at-home test, that type of thing, which also may mean we're actually way above the numbers that we're reporting here in terms of positive cases. What are they doing in that state to make sure people do have access to testing?
Yeah, that's really happening at the local level. Local governments, local healthcare systems are trying to help fill that gap and that void. In Durham County, to my northeast, local health officials there distributed thousands of free at-home rapid test kits to the public. Masking is another huge way that they're trying to sort of rein in this problem. Durham County also sent out tens of thousands of masks. Here in Charlotte, the large hospital system Atrium Health announced just yesterday that it's donating 200,000 of those KN95 masks. Those will go to the local health department. That's where those masks will be distributed to testing sites like this one, where they'll go to the public and the healthcare workers actually doing that testing.
All right, Erica Edwards in North Carolina. Erica, thank you.
Let's now bring in Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, always great to see you. Thanks for being with us. So just a moment ago, at the beginning of when we first started talking to Erica, we heard from a doctor who spoke about this silver lining with this Omicron surge. So despite the high number of hospitalizations, fewer are ending up in the ICU. Obviously, that is a little piece of good news. What do you think that tells us about the severity of Omicron? And does this mean maybe we get past this surge in a way that's hopefully not too far off?
What these anecdotes tell us is that what we saw in South Africa, those early reports of less severity, less ICU bed utilization, is likely true. However, this is something that is just a silver lining. It's not completely a way that we're going to dodge any bullets with Omicron, because it's still severe enough to put hospitals into problems, especially hospitals that had already been hit hard with Delta, hit hard with staffing problems. But it is something that I even noticed myself rounding this weekend, that I didn't see as many sick patients with COVID-19. I saw a lot more people who were testing positive who were admitted for other reasons, which is clearly different than what we saw in the past. And I think that's good, but we still have a couple of weeks to really get through to make sure that our healthcare system doesn't collapse.
And I think that's an important distinction there when we talk about the numbers. People who have COVID but are hospitalized, not necessarily because of COVID, which to your point is different than in the past. I want to ask you now about schools. So this morning, the Biden administration announced increased access to testing for schools nationwide. That includes 5 million free rapid tests for schools each month, an additional 5 million PCR tests a month for any individual, and pooled testing needed, and also an expansion of community testing access. So we've seen the concerns about teachers, like, for example, in Chicago, about returning to the classroom, and here in New York City, hundreds of students actually staged a walkout over COVID concerns yesterday. Is this level of testing enough to ease students' and parents' minds? What else do you think needs to be done to make the classroom safe?
Testing is going to be a major component of keeping kids in school. The CDC has really great guidance on something called Test to Stay, where you don't have to quarantine an entire classroom for an exposure. But the success of that type of program is really premised upon having enough tests to be able to do that. So it's going to be important for the foreseeable future that schools have ability to test. It's also true that schools need to have vaccination rates higher. We know that children tend to be one of the least vaccinated groups in this country. Having more vaccinated children makes a school more resilient. It's also something where teachers need to be vaccinated, because if teachers aren't vaccinated, they may call out sick more frequently. They may get severe disease. We want teachers to be vaccinated almost as a condition of employment, if that can be possible in a school district. And then masking and social distancing are going to be important based upon what's going on outside the classroom walls.
And Dr. Adalja, quickly, another question on testing for you as it relates to the Omicron surge. So the Abbott at-home COVID test, something a lot of us might recognize at this point in the pandemic, can detect most infectious Omicron cases. Now, there's been a lot of concern about whether a lot of these rapid tests that you're just able to buy yourself at a drugstore can effectively detect this particular variant. If people think they have COVID, what should they do? Should they get one of those tests? Should they also get a PCR test? What should people do, especially if they are symptomatic?
If you're symptomatic, the first step should be one of those antigen tests, because if it's positive, that gives you your answer. But if it's negative, you still have to figure out what you're sick with. Is it COVID? Is it influenza? Is it strep throat? So you should still isolate and then get more formal testing. And whether that's a COVID PCR test or a formal antigen test at an urgent care center, or get tested for flu, that's kind of all the steps that you need to take. You shouldn't just ignore you shouldn't just ignore your symptoms if you have a negative test. You need to figure out what you're sick with.
All right, Dr. Amish Adalja, great advice there. Thanks so much. And as you all at home have probably noticed, we talk to doctors here every day, and we want to know what you want to know. If you have a question about COVID, maybe this variant, maybe you're unvaccinated and have concerns, we want to get questions straight from you to our doctors. Email us at morningnewsnow@nbcuni.com. There it is right there. I know it's a long one. With your questions for our doctors, and we'll get them on the show.
COVID has been dimming the lights on the Great White Way over the past few weeks. As we've extensively reported, Broadway bounced back to standing ovations last September. But now the surging Omicron variant is shuttering some of New York City's top shows. This morning, we're hearing from those directly impacted by those closures. The almost wildfire-like spread of Omicron threw a wrench into the holiday peak that Broadway has grown accustomed to. 4 productions shuttered their doors early. The play, Thoughts of a Colored Man, and the musicals, Jagged Little Pill, Ain't Too Proud, and Waitress. For many in the Broadway community, it felt eerily similar to the 2020 shutdown.
I think all of us have emotional impacts of that shutdown that we have probably not fully dealt with, myself included, by the way. So it's almost like having PTSD.
Broadway's initial closure nearly 2 years ago sent shockwaves throughout the entertainment industry and New York City.
We were planning for a 2-week to a month shutdown, and even that was tragic. When it became obvious that there was going to be a longer shutdown, it became almost crisis.
But hope returned in the summer of 2021. Thanks to rigorous health and safety protocols in September, Broadway was back.
You can't overstate what 18 months without Broadway is like for people that love Broadway, but certainly for the people that work on Broadway as well. So I think everyone is really happy about that. But of course, there's anxiety with Omicron and COVID in general.
That anxiety was well-founded. According to the Broadway League, revenues the week before Christmas fell 26%, dropping from $30.5 million to $22.5 million in a single week. Audience numbers also plummeted by more than 60,000 people.
When we got the announcement that we were closing, we got it over a Zoom meeting. And usually when you get a closing announcement, it's backstage, a producer calls a meeting, everyone knows what it's about.
Joshua Henry has been on and off Broadway since 2008, most recently playing Dr. Pomatter in Waitress after the reopening.
I've been really blessed to close a lot of shows under circumstances that are not COVID related. So this one hurt.
The abruptness of Waitress closing early shows just how unpredictable the pandemic has become.
I think every time anybody tries to think of what's coming next, COVID is like, LOL, best of luck figuring this out, because anything could change in any 24-hour period.
I mean, we were being tested every day, antigen and PCR tested, and I'm still kind of wrapping my mind around it.
But the curtain has not come down on Broadway like it did in 2020. In fact, as of January 7th, 27 out of the 28 shows open on Broadway were performing. A full stop of productions has not been considered.
I just want to make it real clear. Broadway is open, and we have no intentions of shutting down. None. We have 17 shows that have not opened yet that are coming this spring, and to date, they are all planning to come.
The ability to stay open is a testament to the protocols in place, with the league following the advice of 3 different epidemiologists.
One of which actually works directly with us, and we coordinate with the unions the protocols to ensure that the cast, the crew, and that the audience is safe.
Science and vaccines have also changed the morale and atmosphere on Broadway over these closures.
I just try to remember that the world of today with vaccines is a very different world than March 2020.
For Joshua Henry, this break off the stage gives him time to work on his music, spend time with his 3 kids and wife, and admire the fortitude of theater in New York City.
I'm happy that there are shows that are open right now, and I mean, that's just a testament to, like you said, Broadway's resilience.
If you've been to a Broadway show, you know for the audience, there are just a lot of precautions.
Mm-hmm.
You have to be vaccinated. You have to wear a mask. There are people who go around, and if that mask is below your nose, they do say something to you. So it is safe. But for the performers, it's harder because they don't wear masks, obviously, when they're performing. So,
yeah. Oh, and you just feel for them. What great interviews they're hearing from them, their accounts. But he's right. The resiliency is what's really cool to see.
They're still pushing through.
Yeah. All right. Thanks, Joe. Yep. Now, this morning, Reid, a giant of the Senate, will lie in state at the U.S. Capitol. Reid passed away last month at the age of 82 after a battle with cancer. A pivotal figure in Congress and in the Democratic Party, Reid represented the state of Nevada for 30 years. He also became one of the longest-serving Senate majority leaders ever. NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Hi, Leanne. Good morning. So first, just tell us what we can expect from today's ceremony.
Good morning, Savannah. So yes, Senate then Majority Leader Harry Reid will lie in state at the Capitol today. We expect Speaker Pelosi, Majority Leader Schumer, and Vice President Kamala Harris to give their remarks today. The ceremony is going to be this morning at around 10:30 a.m. And then he will remain in the Capitol until about 4 or 4:30 p.m. when he is then removed and flown home to Searchlight, Nevada. Savannah.
And now, Leanne, Reid spent 8 years as the Senate Majority Leader during a hugely important period. It included the Great Recession and actually most of President Obama's time in office. Tell us, what were some of his biggest accomplishments? How would you sum up his legacy?
Yeah, so Senator Reid was someone who was instrumental not only in President Obama, then Senator Obama running for president, but also President Obama's agenda in key in passing the Affordable Care Act, being able to keep all 60 senators together, 60 Democrats together in order to pass that legislative accomplishment for the former president. And at a memorial service in Nevada over the weekend, President Obama spoke about how important Senator Reid was to him and his legacy. Let's listen.
Harry cared so much about his fellow Americans and so little about what anybody thought of him. It was all searchlight, no spotlight.
During my time in the Senate, he was more generous to me than I had any right to expect. He was one of the first people to encourage me to run for president, believing that despite my youth, despite my inexperience, despite the fact that I was African American, I could actually win.
So he had a big imprint on people's lives. I'm also from Las Vegas, and so I know what sort of imprints he's had on that state and on that city. I have a lot of friends who work for him, and they say that he is one of the most generous, loyal people they've ever met.
Oh, that's great to hear. Leanne, quickly, before I let you go, let me switch gears here and ask about some other Hill news, the latest on the January 6th investigation. The House committee subpoenaed 3 more people close to the Trump family. Tell us the latest there.
Yeah, they sure did. 2 of Donald Trump Jr.'s top political strategists, and then 1 person who was a speechwriter for the former president. The January 6th committee wants to know any sort of information they have on the lead up to January 6th, including the process of writing the former president's speech on January 6th at the Ellipse. Now, 2 of those people have not responded to requests for comment from NBC News, but one of them, Andy Sarabian, said that he will cooperate with the committee, but he doesn't understand why he was subpoenaed. He has no information to give. Savannah.
All right, Leanne Caldwell, thanks so much for covering all of that for us this morning. And let's now get a check on your morning news now weather, which means it's time for Bill Karen to join. Bill, you got a quiz for me this morning, or what's happening?
No, I mean, Joe wasn't happy yesterday with, you beating him. So, we'll just, we'll just keep it nice and kosher. We'll take a break for a bit. So,
okay.
All right. So yeah, exactly. So let me give you this forecast. So northern New England is still cold, but it is warming up significantly. So we're getting rid of that Arctic air mass during the day today. It's a chilly start, though, but, we're still at -8 in Caribou, Maine. So Maine will be the last location to get rid of that really cold air. More typical teens right now around Boston. New York City's at 25, DC's at 27. And this afternoon, it's going to be hard to complain. Temperatures will go all the way back up into the 40s, even mid-40s in D.C. New York breaks 40 degrees. So this is a vast improvement over what we dealt with yesterday. But a heads up for Saturday. Saturday now is looking very cold in New England. High temperatures will be in the single digits in Burlington, only 20 in New York once again. That'll be similar to yesterday. And watch out for that football game. New England is playing at Buffalo on Saturday. High temperature of 10, likely game time temperature will be in the single digits, wind chill in the negative numbers. So that could be an interesting watch, just to watch what it looks like them to play in that colder weather. And as far as the only troublesome weather out there today, the Pacific Northwest, we have a rainstorm for you. Snow elevations are very high, so we do worry about the chance for avalanches, but we're definitely concerned with the flooding potential. The green shows you flash flood watches, where you see those little red or maroon rectangles. That's where we have flash flood warnings that are in effect. So we are already seeing some significant issues there because of the heavy rain and the snow melt, and we are concerned with flooding and mudslides. So the forecast for today, pretty quiet in the middle of the country. In Savannah, you survived yesterday. You get to enjoy a little warm-up. Next hour, your weekend forecast, and stay tuned. We have a very big winter storm heading across the country, so details ahead.
All right, that is a tease. And yes, it was freezing yesterday. I did still do my usual walk home. I questioned that decision, 50% of the way through or so, but I completed it. All right, yeah, thanks, Bill. Coming from an Ironman, that means a lot. All right, see you in a bit.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.